Welcome to the ChiroUp 15 Minutes to Excellence webinar, where our goal is to provide you with some useful new skills to build your practice in 15 minutes or less. This is part one of our Marketing Essentials series, which details each of the ChiroUp marketing campaigns. It explains the concepts and provides advice to help you implement this strategy. Marketing is a process of planting and harvesting. I think there are three types of planting, or three types of marketing. First, there's internal marketing, which is relatively low cost with a good return on investment as far as patient loyalty. The next type of marketing would be external marketing, shown in the teal here. It's relatively high cost. These things would be yellow pages, websites, newspapers, and unfortunately that high cost produces a relatively disloyal patient. In the middle is our professional marketing. This would be marketing to MDs and other specialists, and this is relatively low cost, but a relatively high return on the loyalty. So that's where we're going to focus our Marketing Essentials series. Part one is on MDs. Working closely with medical physicians will allow you to increase the number of new patient referrals, but it'll also increase your reputation throughout the community. Building relationships with primary care physicians certainly takes time and energy, but the outcome is well worth the effort. Basically, this marketing works. This presentation is going to consist of about 35 slides, and if you implement any one of those slides material, your practice is going to improve. If you implement all of the material from this whole campaign, your practice is going to explode. This information provides a blueprint, and this blueprint produced over 250 MD referrals in our clinic last year alone, and I'm going to show you exactly how to make that happen. Referrals are part of the 4R formula. It's reputation and results plus relationships turns into referrals. Relationship marketing is the most effective type of marketing, and loyalty is tied to relationships, and loyalty begins with having a great product. The prerequisite is having trust and a mutual respect with primary care physicians in your area. This includes making sure that you don't speak negatively about any physician or their procedures or a medicine, and that includes vaccines. Make sure that all the messages, including the brochures and your website and handouts and your whiteboards, are congruent with the philosophy that your office is medically friendly. You as a provider know the MDs in your area who speak disparagingly about chiropractic, and the same is true on the other side. MDs know what you're saying. So make sure that your office is MD friendly, and we also want to make sure that our treatment plans are outcome based, that they have an endpoint, and we're striving for getting that patient out of pain as quickly as possible. All of the material that we'll discuss today is going to be available on ChiroUp if you go to the Manage and Grow My Practice and the Marketing Campaign tab. If you click on MD Marketing, it will take you to a synopsis of how to implement this material. The gray box on the left side has links to every type of sample and script that you'll need. We'll show you a couple of these today, and I'll start with the basis of this process, and it's making a list of all the primary care physicians in your area. You can collect this from phone directories or hospital websites, and it should be compiled on a spreadsheet. This can be done by a staff member. The spreadsheet's the foundation for reaching out to MDs, as well as tracking your meetings and referrals from those providers. We segregate our spreadsheet into three different sections. The green section are MDs who refer on a regular basis. The yellow section we use for those who refer periodically but not consistently. And the red or orange section is for those who have not yet referred. So we can apportion our efforts according to our relationship with that MD. And relationship is obviously part of the 4R. One of the best ways to build a relationship is through face-to-face meetings. So we mail an introductory letter to the MDs in our area asking them to meet for lunch. You can see that this can be found in the MD introductory letter of the gray box. Unfortunately, this introductory letter often goes unanswered. So we actually go by their office. We follow up, and we'll take half a day and visit the physician offices in the area and request to set up a lunch. You can do this yourself, or if you're not comfortable with the process, then ask a friendly outgoing staff member to do this for you, and we can provide the script. The script would include, this is who I am. I'm dropping off this package. The package includes your CV, some information about your office, an evidence synopsis, and a copy of the letter that you had sent before. All of those are available on the website. And you want to let them know that since you share several mutual patients, you'd like to set up a lunch to get them know them a little bit better. The MD's receptionist is going to be very familiar with this type of process because drug reps visit every day and make the same request. Most offices will simply get out their scheduling book and say what day works best for you and drop you into their plan. Then you need to be prepared. So we use the professional lunch prep checklist to track the specific details of each visit, like the day and time, the number of attendees that you'll prepare for, any food preferences, religious absences, or allergies related to food. Make sure that you take this and have your receptionist block your schedule so that you have adequate time for the lunch. And don't forget that it's not unusual for the MD to be running an hour behind. So you don't want to waste the money and time of a lunch because you had to go back and see patients before the MD was able to make it into the room. Block adequate time. For a noon lunch, we'll typically block from 11:30 a.m. until 2 p.m. We'll also call on the day of the lunch or the day before to make sure that everything is still on. You can either choose to pick up the lunch yourself by adding some cushion time because restaurants are generally unreliable at providing the lunch at the time that you need. Or you could choose catering. We choose the latter. A catering, we found someone in the area, a small restaurant who's willing to go to the MD's office, set up lunch and provide everything that we need. It saves us time and we just show up at the time of the appointment and move forward. You want to make sure that on the day of your lunch that you have a cooler, that you bring water and soda, and that any utensils and condiments are there as well. We bring a printed soft-sided cooler with our clinic name and logo, and we leave it behind for the MD to keep for themselves. Then at the time of the meeting, when the MD arrives, don't jump right into your message. This is more about building a relationship. So let them talk about their interests, their family, their practice, and you'll know when it's time to deliver your message. Usually the phrase that the MD will bring up is something like, "So what's new?" And that's your cue to let them know why you're here, and then you'll bring up your talking points. Here's a list of our talking points. It's basically that we're grateful for the chance to have lunch with them, that we manage musculoskeletal cases, and here's some research in the evidence synopsis that proves that what we do is very effective. We provide personalized care just like they do. Our average treatment plan is X visits, and we strive to meet treatment goals. We release patients when they're done with care. We're going to provide timely, excellent documentation. We're providers with various managed care plans, and when you refer a patient, we're going to make you look good. We'll also drop off a folder, and in that folder, there's going to be an evidence synopsis, a technique brochure, our CV, a laminated insurance provider list, and this, which is our clinic info. It's just a basic synopsis of our hours and location, as well as the types of conditions that we treat and the methods that we use. One of the things that we can use to back up that treatment is a technique brochure, and we'll give that to the MD so that they can see what we do. We also use a musculoskeletal treatment pyramid. This is a two-sided handout that we'll give to the patient. It's available in ChiroUp as well. And it's really an excellent way to show how chiropractic care is essential to having a complete musculoskeletal management system. We'll provide the evidence synopsis, which is a 16 to 20 page document that provides hundreds of references to support the safety and efficacy of chiropractic care. It's a great leave behind for the MD. And as I mentioned earlier, we'll provide a technique brochure, which kind of demystifies what we do as chiropractors. One of the more important things that the front desk is interested in is the insurance provider list. They'll want to know who are we providers with. And it's important to establish that relationship with the front desk because a lot of times that's where the referrals come from. So after a successful lunch, we'll drop back to the office and immediately pen a quick post-lunch thank you note. We'll send one to the MD and one to the scheduler as well with some additional business cards because every contact that we can make with the primary care physician's office means that a referral is more likely. We'll also make sure that we are documenting our care well. MDs and patients need to see a pattern of excellence in everything that we do, and this would include thorough standardized documentation. So we'll send an MD initial report and an MD release report for every new patient encounter. We're often judged by the quality of our documentation and communication, so we want to make sure that it's good and that it shows that we're working toward an outcome-based endpoint. Also that we're willing to refer when necessary. That's important because sometimes MDs will send us more of the challenging cases that they've tried everything else and they'll see if we're that option. Well, if you don't think you can help a certain patient, don't be afraid to say, I can't help this patient in that communication. We want to impress the MD by being honest and thorough and concise. We'll send a generic cover letter. If the MD did not refer the patient, we'll send this letter along. And we send it with the initial report for every new patient encounter. just to let them know that here's our plan of care. If the MD referred the patient directly to our office, then we'll go ahead and send the initial report along with a synopsis. And this doesn't need to be time consuming. We have the staff complete the information on the top lines, and they'll drop the note on my desk. So at the end of the day, when I see that I had an initial report from Dr. Smith, I can very quickly dictate from this template, or in our case, we can just do that right into the EHR and ship it along with the SOAP note. And we quickly can reflect positively upon that visit with the patient, and the MD can see what's happening. I think even more importantly is to send the MD release report, that when the patient is done with care, we're going to send over a note. And we send this for every patient because unfortunately the medical community often sees our failures. In the same way that we see medical failures, that we see that muscle relaxants aren't necessarily a good alternative for neck pain or back pain, and they don't often work, the MD sees our failures. The ones that succeed don't go back to the MD and say, I felt much better, so I didn't think I needed to come to see you. So unfortunately, they don't see the good side of the story as often as they should, and this is one opportunity to show them the good side of care on every opportunity. So it's one more reminder, one more connection with that primary care office. Another way that we can stay fresh in the mind of MDs is by visiting their office periodically to drop off some pens or notepads or maybe a small treat like a plate of cookies or some fresh fruit. We'll do this 2 to 4 times a year, and your message is simple. It's thank you for your confidence in referring us your patients. We're grateful, and is there anything else that you need from us? It's also an opportunity to schedule subsequent lunches, which we try to get into the office at least once or twice a year. Now, when you're dropping something off, make sure that you don't violate any state or federal anti-kickback or federal Stark laws that regulate healthcare giving and prohibit any type of remuneration that could be construed as payment in exchange for referrals. There's more about this topic in ChiroUp, or you can check your state and federal laws. One of the things that will drop off on subsequent visits with the MD at our second lunch meeting are outcome statistics. The outcome statistics are a good way to review the patients that the MD has sent over in the past 6 or 12 months and let them know what's happening, and one more reinforcement that your patients are getting better when you send them over. Another form of communication, and one of the more important forms, is newsletters. We'll send bi-monthly newsletters to all the primary care physicians and specialists in our system, and we initiate this program with an intro newsletter. Then for subsequent newsletters, we try to pick topics that are pertinent and interesting to MDs. It's critical that we gain their attention, that we have a quality newsletter. If you're a premium subscriber, you already know how this works. That time-consuming task of assembling a newsletter is done for you each month. Our professionals designed some pertinent and interesting newsletters for patients, attorneys, as well as the MDs, and all you need to do is distribute those. The MD newsletter implementation guide comes with your packet each month. If you're not a premium subscriber, you'll see 7 examples in the ChiroUp database for all members. Here's sample newsletter number 2 that's pre-written for you and kind of gives you an idea of where to head with this process. This newsletter, it can also be modified for specialists in the area. We'll include podiatrists, orthopedists, neurosurgeons, physical medicine specialists, OBGYN, pain management, and even dentists for TMD. And here's a sample of the OBGYN newsletter. Reaching out on special occasions is another way to keep in touch, so we'll send out a holiday thank you card, or for those MDs that we know better, we'll send out a birthday card. We'll also send those to some of the front desk staff who we've established a relationship with. And this is a card that is also particularly useful to send to the MD maybe on a once-a-year basis. At a time where you've not communicated with them in a short period of time, maybe you've dropped out of the forefront of their mind and they're not referring quite as much at that given moment, we'll send them a little note saying we really appreciate this relationship and we'll continue to do the best that we can for your patients. With any relationship in primary care, we need to expect to make multiple contact before the referrals begin, and don't give up if the MD's office doesn't start referring after the first lunch, because they usually don't. You need to be persistent but not annoying and focus on exceptional care, bolstered by regular quality communication, and eventually you'll see results. We thank you for listening to this webinar. We hope you've enjoyed the information, and as always, please contact us with any questions anytime that you need help with your marketing plan.